Good morning all. Today's session is an endotracheal intubation. So outline of the content. What is endotracheal intubation? Purposes of endotracheal intubation. Indication of endotracheal intubation. And what are all the equipments needed for endotracheal intubation? Procedures, post-procedure care and complication of endotracheal intubation. At the end of the class, you will be able to understand, define endotracheal intubation, list the purposes of endotracheal intubation, mention the indication of endotracheal intubation, and enlist the equipment required for endotracheal intubation, explain the procedures on endotracheal intubation, identify the complications of endotracheal intubation. We'll discuss the what is endotracheal intubation. It is in tube, the placement of flexible plastic tube into the trachea to maintain and open the airway. So it is called as an endotracheal intubation. So next we'll discuss what is the purposes of endotracheal intubation. Why you are intubating to the patient? To deliver the oxygen and to remove the secretions and to ventilate the lungs and to establish the maintain of airway and to treat the acute respiratory failure and persistent hypoxemia. So then we'll discuss what are all the indications of endotracheal intubation. The first one is an CNS depression, and in case of CNS depression or central nervous system problems, so like in case of patient with head injury patient, stroke patients, an unconscious patient or altered sensorium, or in case of raised intracranial pressure or neuromuscular diseases like muscle weakness, example in the case of Guillain-Barré syndrome, and then amyotrophic lateral sclerosis, then myasthenia gravis, then muscular dystrophy, or in case of chronic injury, or in case of patient with botulism and brainstem infractions. So then chest wall injuries and then upper airway obstructions. So here the upper airway obstructions like airway problems. So external pressures on the airway or vocal cord paralysis or tumor or infections and laryngospasm, and then aspiration prophylaxis, then fracture vertebrae and spinal cord. As I said in the previous itself, muscle weakness. So in case of spinal cord injury and fracture in vertebrae. So these are all the indication for intubation of the patient. So next we'll move on to this. What are all the equipments needed to the patient in endotracheal intubation? Endotracheal tube of appropriate size. There are different size it will be available based on the patients. Okay, we have to select the size of the tube. Then stillet, then xylogyne jelly, then plastic syringe 10 ml, oral airway, cotton tape, gloves, face mask. So this is a picture, we can show it in this different size of endotracheal tubes, ET tubes, endotracheal tubes. Then it is then laryngoscope with the blade. This is a Meglis forceps. So this is a syringe with use of this to infiltrate the cough. This is a suction apparatus to remove the secretion. Technique of intubation. This is a technique we have to used. Then position, how the position has to be maintained while intubating the patient. So position your patient with the supine position with the head extended by keeping the sandbag or towel, roll it, and under the neck you can keep. So maintain the supine position with head extended by using the sandbags, or you have to roll the towel and keep the under the neck. So then move on to this procedures. Hold the laryngoscope with left hand irrespective of dominant hand. Open the mouth with right hand index finger will support the thumb and introduce the laryngoscope from right angle of the mouth. Shift the tongue to left and go ahead. The pressure over the tongue. See the epiglottitis and lift it and watch for the vocal cord. This is a procedure. You have to hold the laryngoscope and this hand you have to hold the ET tube. So this is the step we have to following. So take the tube in right hand and introduce under vision with the help of this laryngoscope. Then once inserted the tube, so you have to whether the tube is correct position or not. That has to be, you have to confirm the placement of the endotracheal tube by auscultation method. If the tube is curved, infiltrate the curve and connect the source to the tube and confirm the position of the tube by auscultation method and by the chest expansion and by the bag movements, and finally you have to fix the tube with adhesive tapes. So these are the procedures while doing the endotracheal intubation. This is the stabilizing the ET tube. After intubating, you have to insert this tube, endotracheal tube, and here you have to fix it into the tape, adhesive tapes. Finally, the tube is fixed into the correct position. Connection to the ventilator. Finally, this tube has to be connected with the, either it should be an amber bag, an anesthesia machine, and finally it's a ventilator machine. Is an endotracheal tube placement. And then move on to the post-procedure care. In the post-procedure care, first place the patient in lateral position and arrange for the chest x-ray. There are 3 steps we have discussed to confirm the position. So here one more it is there, that is chest x-ray. So in order to check the placement of ET tube, chest x-ray is also important, and then apply the endotracheal suctioning as needed. Is so in that secretion, whenever the secretion is secreting, to avoid that secretion you have to put the suctioning. Watch for the chest movements and ET tube kinking, obstruction, any leakage of tube cuff, and over the inflation of cuff. Move on to this complication. This complication, the tube in esophagus. Sometimes the tube is displaced into the trachea to the esophagus. Then endobronchial intubation. So endobronchial intubation means instead of endotracheal intubation, sometimes it may be happen into the endobronchial intubation. So it may be complicated into the lung collapse or pneumothorax. So this is an endotracheal intubation. The next one is a trauma to the lips and to the tooth. Then laryngeal or tracheal injury. Barotrauma to the lungs. Here the barotrauma to the lungs, due to the alveolar rupture, it will be happen. Due to why the alveolar rupture will be happen here? So due to the elevator transalveolar pressure will be increased. So that is the barotrauma to the lungs. Okay, it can be the most complicated into the pneumothorax will be happen. So the next complication will be bleeding and tracheitis. So tracheitis, it is a bacterial infection of the windpipe, and then pulmonary infection and sepsis. So these are all the complication which is maybe happen to the patient while intubating the patient. So that's all about the endotracheal intubation. Thank you for your time and attention. Thank you all.